Okay, my friend, thank you for coming. It's really a big pleasure for us and too much honor for us to have patients like you from abroad, from other countries. And of course, you live in the United States, right?
Yeah.
Which part?
In the Midwest, in the center.
Yeah. Okay. So it's really an honor for us to for you to come here for this treatment, and it's very different, surprising that my patients find me and they diagnose themselves. Very interesting. I didn't diagnose you. Your doctors couldn't diagnose you, and you diagnosed yourself. And it was a real story for us to it was crazy.
Yeah.
We were trying to do the physical examination online on the screen.
Yeah.
Because you were showing me the veins when you stand up. It was really seen, very bulgy veins there. But you diagnosed not to have these. What happened? Can you tell me?
Essentially, I saw some doctors. I got some scans. And they told me that there was nothing wrong with me.
So you had varicocele procedure, the first
Yes,
one when?
2 years ago.
2 years.
And then I had an embolization.
This is a microscopic, open, normal microscopic
so
surgery.
they cut me open.
Yeah.
I have a scar from it.
Yeah.
That was 2 years ago, but it shrunk a little bit.
Huh.
It shrunk.
Before this operation, was it really big?
Yeah, it was really big before. And then after that, it got smaller,
We call
but
it
it's still big.
bag of worms.
Yeah,
We call
bag
it
of worms, exactly.
Like, so it shrinked a little bit.
It did. I would say maybe like 30%.
30%.
But it's still obviously big.
Yeah.
And that I waited a really long time to do anything about it because I knew the procedure takes a while to see the results.
Yeah.
And
Usually
then,
1 year.
Yes, so I waited a full year.
You waited for a year.
Yeah, for that, and then I had an embolization, and that.
So how you decided to have embolization? Did your doctor recommend it?
Yes, my doctor. So my doctor who I had the first procedure done, he wasn't very excited about me doing anything else, but he said if I were to do anything else, it'd be an embolization.
Yeah.
And then I had to jump through a ton of hoops to even find someone to do that for me, and eventually I did find someone. But
in your city, in your same place, did you find him?
I had to travel to a different state
because it's a little rare.
Yes, it is.
The procedure nowadays. Not everyone is doing that, and unfortunately, one of the problems, not the urologist is doing it, so a radiology, invasive radiologist, interventional radiologist doing it. The problem is they can't follow you, right?
Yeah.
So you go back to your urologist after the procedure?
Yeah, so I traveled for the embolization. I went back to my urologist, my doctors, and they were like, we don't know what to do for you. They did some scans, and the ultrasound said I had no varicocele, which is not true, and I knew it wasn't true.
Yeah.
Because I could feel them, and I could still see them, and I
So
felt
excuse me,
pain.
you said you are seeing some bulging veins there. When you go there, they did the ultrasound, the Doppler, and they said there's nothing, right?
Yeah, they said in the report that I got for the ultrasound, it says I'm healthy, essentially completely healthy. They said there's nothing wrong.
Why it's like that?
It's because I was lying down, I suppose. The veins shrink when you lay down.
Yeah, it makes sense. When I say I have to do the Doppler in the upright position, all the patients listening once, they said, yes, this is true. But never the urology, the radiology, doctors, the technicians, they never accept, it never makes sense on them. They never do it.
And I tried to convince them. I told them, I said, I need to stand while I'm doing this because that'll make it appear on the ultrasound. It makes it bigger because they disappear sometimes when you lay down. And they said, we don't do that.
Yeah.
And so I
I operated one guy one day before you from UK.
Yeah.
And I examined him in upright position. And I didn't see anything. He said, they did it in laying down, and he had a report. He has varicocele, both sides. I said, okay, why not? We have to do examination in both ways. When he lay down, the veins appear. So it has to be done. If you don't see it in upright, you have to use the laying down position too. I knew it, but it was a good lecture for me. I learned one more time. So you were feeling, you were touching, and this vein, you were understanding that there is something. But when you go to radiologists, they said there is nothing.
Yes.
But you didn't convince. Why? What? How?
I wasn't convinced. Yeah, I had pain. I could still feel the veins. I could still see the veins.
Yeah. How was the pain? Is it really?
It can be very uncomfortable.
Yeah.
It's
like
not
every day or once a week.
Every day. I felt it every day. It comes and goes, and it's not 24/7.
Yeah.
but I would feel it every single day at
So
some
you
point.
remember, you noticed that there is something wrong every day.
I mean, I've had the varicocele for so long, I know what it feels like.
So when we did the online consultation first time, how
Yes.
many months before?
That was, when was it? That was might have been June.
Yeah, June.
It was a while ago. It was maybe
So
3 months
maybe
ago.
I said I supposed to say you have to wait a little more
Yeah.
after 1 year is over after the any procedure, because the conventional procedures, embolization or ligation of the veins, when you occlude the veins, the vein is not disappearing next day.
Yeah.
It will take some time. This may be 3 months, this may be 6 months, 1 year. So I like to wait 1 year. Sometimes it's very prominent, maybe 6 months. If there's a lot of pain, I don't want to leave the patient with agony for 6 months. We
Yeah.
can do a little earlier, but you waited. So you waited for 1 year, but it didn't disappear.
No, the veins never went away. And my
So
radiologist basically, my radiologist basically said, I'm not sure what else for you to do. But then I knew about you.
Yeah, so if you didn't find me, normally your urologist say you have to go to radiologist. Radiologist says it is over, I don't have anything to do.
Yes.
But he is not examining.
No.
Yeah, this
No.
is the problem.
Yeah.
How was the urologist doctor was making examination?
Yes.
And what was he saying?
He said, I don't know what else to do. He said,
Did he say there is varicocele still there?
he said it's still there, but I don't know what else for you to do because I already had the varicocelectomy done and I already had the embolization. He didn't know what else to do for me. So he said you just had to live with it basically. But the ultrasound report said I had nothing.
Yeah.
Which was
yeah,
an issue.
ultrasound nothing because you are laying down.
Yes.
But when you were standing up.
Yes.
So very funny our story.
Yeah.
I wanted you and you wanted me
Yeah.
to make a physical examination on the online consultation, which is impossible.
Yes.
But you try to show me online these veins. I couldn't see for good, maybe the lighting such things. Then you make a video how many times?
I said like 5 or 6
5 or
videos.
6 times. You made good videos. That in the first video I said, okay, this is vein, I can understand. But I can't give you 100% guarantee that there will be this vein I can find. So because you will travel from United States like 12 hours with plane.
Yes.
Yeah, it's crazy, but we have to do this because you were sure 6 videos, and in every video it was better. You show
It's
me
more
better
fair.
and better, and I said, okay, you come and let's see. Maybe you will travel for nothing. You will make sightseeing, but you had pain. I was sure you had this. If you didn't have the varicocele, you would have prostatitis. There is only, and the other reason which is causing the testicular pain in a chronic fashion, not acute testicular pain, I don't mean epididymitis, such things, but chronic pain in the testicle, if it is not varicocele, it is prostatitis. So I said, okay, I can treat prostatitis. I have some special treatments for chronic prostatitis, which is now keep them out of subject. It's a very long story. So you convinced me that you had the varicocele, and you came. In the operation, it was very surprising for me. Both of your operations were successful. The first operation, microscopic surgery, I find this persistent vein there, of course, which you mentioned. There was a big, long, maybe 20 centimeters, maybe more than 20, like
25. It was
25 to 30. I dissected this vein. I dissected it till the end. When I come to inguinal area, I saw the stitch that the first doctor, they ligated.
Yeah.
This is what is told in our education. Ligate this vein. It will disappear. But it is not disappearing in some cases. The vein was there, the ligature was there, ligation was there.
In the photos you sent me of the veins, you can see the ligations on the veins
Yes,
themselves.
yes.
Yeah.
So the first operation was successful. He ligated them all. Then the second operation, when they make the embolization, it will shrink the internal veins, and your internal veins are shrunken. They all treated well. So it is not the fault of the doctors.
No.
It's the fault of the technique. What they don't understand is I ligated, why it's not disappearing. So it has some little tiny connections to surrounding other veins. This might be gubernacular vein, this may be internal vein, some little very tiny vein. This makes the blood flow inside this vessel continuous. And in some cases, 30%, it is not disappearing. And the embolizators, they cannot reach to external veins.
No.
So they quite nicely treated the internal ones, but gubernacular veins were there, external vein was there, ligated. So both of the procedures were successful, but they are not enough. For me, what is the best treatment for a varicocele? For me, it is taking out these external veins. It is very easy. Taking out external veins. It's really they are away from other vessels. You can, in 5 minutes, in a primary case, you were a secondary case, you can take it out. And previously, I was just doing the internal veins as conventional procedures, just ligating or cutting in between, making a small dissection. Now, I am also, if it's a primary case, dissecting the internal veins too, which is not always possible. Sometimes, actually, there are always two groups of veins. One is alone, it is going along. One is together with artery. So this one, sometimes it's maybe in 80% of the cases, it's possible to separate it from artery, like this artery you can separate. You can take both of them out. In 20%, it's impossible. So I ligate these veins in many parts. I have still 3% recurrence, which is really killing me. I am very thinking about it every day. For this, embolization is a very beautiful choice because I take out the gubernacular and external. There's only internal veins and the veins that I couldn't take out because of the artery.
Embolization will cover.
Embolization will really cure it 100%. So people should understand this. Embolization is a very nice procedure. It was, of course, easier than my procedure, easier than the first case, first procedure. You can walk quickly, but it cannot reach to external veins. So, to tell how is coming from United States and having this procedure for secondary procedure is always difficult. So we have to put a drainage tube inside. It is too much discomfortable. So how was your experience on that?
I mean, it was easy. You helped me
coming
set up.
Coming to Turkey and
Yeah.
how many days you arranged to come here?
I was here 7 days, and I
For
had
7 days.
and I had the procedure kind of in the middle of the trip.
Yeah.
So
you had some sightseeing before.
Yeah, I figured if I'm coming to Turkey, I should see it a little bit.
Actually, this is because I call the patients just 1 day before surgery to lessen the expenses. But if you're coming here before the operation, 2 days of sightseeing is nice.
I figured if I'm paying for a plane ticket, I might as well see the city a little bit. So I saw the city, and then I came in and saw you a day before the procedure, and we talked, and then I had the procedure, and it was really simple. It was easy.
Yeah, really. And then after the procedure, you stayed at home for 2-3 days.
Yeah, so I was staying in the hospital the first day, and then I stayed at home yesterday, and now I'm here today. And I'm still sore, but it's not that bad. I'm already feeling better.
Yeah. Okay, so it is a doable thing to come and make the operation here. And nowadays, Turkey is not too much expensive.
No.
I don't know what will be in the future, but nowadays the currency is decreasing a little bit, so it's a great advantage for foreigners to come and have this procedure. Thank you for coming.
Thank you.
It was really great pleasure for us. Do you feel any difference after the procedure about your vein? Of course, if this secondary procedure, too much swelling in your case, bruising, such things, how do you feel?
I mean, it already feels different. Like I don't feel the vein anymore.
Were you feeling this? There is something.
Yeah. Every day I would feel it. I would feel the vein, like whether I could physically touch it and feel it, or if I could just feel a sensation.
Yeah.
It has this dragging, this hanging sensation. It feels heavy.
Yeah.
I don't feel that anymore. So that's bizarre because I've been living with it for a decade, for 10 years. So now to not feel it is kind of a strange feeling, and I'm sure I'll get used to it.
You have the secondary operation is a little difficult. You have more edema than compared to a normal one.
Yes.
Ordinary one. Still, you can say that.
Yeah.
But people who are primary cases, they really say, oh, it's gone.
It's immediately gone. Yeah, I have some swelling
Yeah. So
but it
thank
feels
you,
good.
thank you. This operation. The best thing about this operation is this. The vein goes immediately.
Yep.
We make your initials with
Yes.
those veins. I like it because I have too many operations. I don't want to mix the veins. After in my phone there are
Yeah.
pictures whose veins were that. So this is this one initials.
Yeah.
So yeah, it's really my practice moved towards varicocelectomy now. I am very rarely operating other things, just some resume prostate surgery, which is again a minimal invasive surgery.
Mm-hmm.
And in women, I have some special technique for women too,
Yes.
for cystitis. Other than that, I am not operating other cases. So I am focused on these cases, and when you focus on a simple disease, varicocele is seen very simple among the urologists, you find the weak parts of it and improve it. I am happy. Thank you for coming again.
Thank you so much for having me. Thank you.